Welcome back. I'm Esther Githui-Ewart, sitting in for Shaka Sali, who is on assignment. Today, we're talking about the Zika virus. Our distinguished guests are Josh Michaud with the Kaiser Family Foundation, Dr. Ronald Waldman, a professor at George Washington University, and Carol Pearson, VOA's health reporter. I will go back to you, Dr. Waldman, because if Zika virus was reported like 50 years ago in Uganda, do we know then if the microcephaly was detected then and what really happened, what was done? Because we don't know much about that and it doesn't seem to have really gone across the region. That's as right. much as Ebola.
We know that it was not detected, or at least not signaled then. It may be, as Josh has said, that because it's such a mild disease, that because it's been circulating for some time in Uganda and probably neighboring countries in Africa, that many people may have been infected with it, did not know about it, but have developed immunity to it. Now that the virus has managed to reach newer parts of the world where it has not been found before, it's encountering a population of people who have not been able to develop immunity, and therefore maybe it is spreading more rapidly and more explosively. But again, we just don't have all the answers in yet by any means whatsoever. There was a meeting at the World Health Organization this morning where representatives from the Ministry of Health of Uganda pointed this out to the WHO authorities, saying, we have had this virus since 1947, we have not seen microcephaly, we have not seen Guillain-Barré syndrome, therefore it must be something else, was what the representative from the ministry said. We don't know for sure that it's something else, but it's important to say at this point in time that we don't know for sure that the cluster of microcephaly in Brazil and the cluster of Guillain-Barré in Colombia is in fact caused by the Zika virus. We don't like to use that word very much in public health and in epidemiology. It's difficult to establish a cause for a consequence. It seems likely at this point that there is enough of an association between these events, the introduction of Zika virus into Brazil and the rest of South America, and the increase in the number of cases of microcephaly and Guillain-Barré, that it warrants further intensive and rapid investigation. And that's where we're at now.
And so what is the WHO recommending? Because one of the concerns when you read some of the comments from our African audience, they're concerned about the Aedes aegypti mosquito traveling from one region to another. How easy is that when you compare with someone who is infected moving from one country or one region to another? Josh?
Well, the mosquito already exists across much of the world at this point, especially in temperate and tropical regions. So the vector, as they say, or the mosquito that can carry this virus is already present. So as you point to, people have a role in this too. So at some point, an infected person likely came across the Pacific and brought the virus. It's much easier for a person to carry the virus along in a plane, say, than a mosquito to fly across the ocean and bring it. So it really is a matter of, in this case, travel and trade and an increasing globalization across the world that has led to these circumstances where we've had this introduction into first the Pacific area and now into Latin America. So I think the conditions have existed in Africa. The mosquito's been there, the virus has been there, but as we've said, we just don't know how widely it's currently spread. Partly there might be immunity existing in the population, therefore that's why we don't see outbreaks and we haven't seen these clusters of birth defects associated with the virus. But more study needs to be done on this question.
Carol, what are you getting from your listeners when you delve into this topic? Some of the questions that you really didn't even think about, because I mean, viewers come in with all manner of questions. They're using all our social media platforms. What are some of their concerns?
I think most people are concerned about whether they could get the Zika virus and if they could then transmit it. And that seems to be the biggest concern. Will I get the Zika virus? Will it spread where I live? and they're concerned about the impact that it might have. And I think a lot of people really don't know how inconsequential this virus is, except for a possible link to birth defects, because, as we've said numerous times, 80% of the people who get it don't know they have it. So it's kind of inconsequential as a virus.
They don't show the symptoms. Like Dr. Ron, you talked about, you've written intensively about this, and I saw you've done some research too about WHO, and also how the Ebola virus ravaged West Africa, and what needs to be done so we don't see another scenario like that.
I think it's a different situation, and I do think that when it comes to the Zika virus and its consequences, I think the system worked. I think that the cluster of microcephaly was detected relatively early in northeastern Brazil. It was reported to the authorities. The authorities in Brazil, the Ministry of Health, reported it to the regional office of the World Health Organization, the Pan American Health Organization, and they reported it to WHO headquarters in Geneva. Work had already begun, collaboration had already begun as early as May of 2015 between the World Health Organization and the Pan American Health Organization and authorities in Brazil. So I think that the system actually worked well. I think that we're living in a time when there's a lot of pressure on agencies to perform, and WHO came under intense criticism because of its handling of the Ebola crisis in West Africa, where that disease was detected in December of 2013, but not acted upon by WHO until August of 2014. So an 8-month gap went by without WHO declaring that situation to be an emergency. And that's a disease that, as we know, ended up affecting tens of thousands of people and killing about 11,000 people. So the situation is quite different. Now, WHO, I think, has been criticized by colleagues of mine regarding Zika virus for acting too early, for acting on political grounds rather than only on scientific grounds. I think that's absolutely excusable in this case. I think that there is an important combination and a link between the public health and scientific imperatives, and we've been saying here that we don't have enough science to be able to say definitively what the situation regarding Zika virus is. But I think that WHO had to act. As the Director General, Margaret Chan, said when declaring this situation to be a public health emergency of international concern, she said, imagine what would happen if we did not do that. And then it became more important later on. Then we would have another situation in which WHO would be subjected to intense criticism and maybe even be dissolved. The organization wouldn't be able to continue. So I think it's good that they did that. What happens now that they have made that declaration? Well, as I said, I think they'll be able to coordinate the efforts of different countries much, much better. I think they'll be able to direct the research efforts into the development of vaccines and potentially treatments, diagnostic tools. I think that they'll be able, most importantly, to provide us with some international leadership and guidance over what is likely to become an international problem as it plays out over the next few months.